All right, so we are recording. And okay, so Dr. Gastaldo, we're going to ask some viewer questions that weren't answered last night. The first one we have, does something in the shot attach to your DNA forever?
Absolutely not. When you get injected with an mRNA vaccine, the mRNA teaches your cells to make the spike protein to induce an immune response. But when you get injected with that mRNA, it's taken up by your cells. The mRNA is degraded within hours. It does not alter your genetics or your DNA. It's degraded along with the spike protein in a short period of time.
All right, the next one. Can a group that's been vaccinated and they all wear masks get together comfortably, say 8 to 10 people?
Yeah. Well, we really don't know yet. We still have to study in more detail what impact vaccinations will have on asymptomatic infection. Now, granted, everybody has COVID fatigue, and there are some signals coming out in some studies that do indicate that vaccinations will likely impact asymptomatic infection or transmission. We don't know yet. Plus, two, if you're in a group of people, are you necessarily certain that everybody has been fully vaccinated? Full vaccination means that you are at least 2 weeks out from the second dose of an mRNA vaccine and 2 weeks out from a dose of a single Johnson & Johnson vaccine. In addition to that, if a group of people are together out at a restaurant, you're out in the public. And the recommendation is, especially even if you've been fully vaccinated, wear a mask when you're in the public because not many people in the public have been fully vaccinated.
All right, the next one. I got my first dose, but no appointment for the second dose. Should I be worried?
Well, best practices for scheduling your appointment are as follows. When you make your appointment for your first dose, when you go in before you leave, you should have an appointment made for your second dose. At Ohio Health, that is what we do, and that is considered best practices.
Next one, do you have less of a chance of getting the virus again after you've already had it?
Great question. When people get infected with the virus that causes COVID-19, most people do get a level of immunity. How long that immunity lasts after having infection, we really don't know. The official recommendations from the CDC are as follows. If you have previously had COVID, as long as you are out of isolation, you're not contagious anymore, and you are feeling better, you can choose to be vaccinated.
And our last question, if I'm pregnant, how can I be confident that the vaccine is safe with studies currently underway?
So it is true that pregnant women were not put in the studies for Pfizer, Moderna, and Johnson & Johnson. When one thinks about COVID-19, you always want to make a decision. What are the risks versus benefits of getting a vaccine? We know that pregnancy is a risk factor of having a bad outcome from COVID-19. And based on what we know about an mRNA vaccine, it is very, very likely that this vaccine is safe in pregnancy. It is not a live vaccine. Throughout 2021, the learning and the science continues. There were 15,000 pregnant women who were vaccinated who participated in the V-Safe app from the CDC. There were no safety signals from that. In addition to that, Pfizer is now doing a safety study on pregnant women for their vaccine. So as 2021 comes along, I feel confident in saying we will have more safety information for pregnant individuals. The American College of Obstetricians and Gynecologists have a statement out stating that pregnant women should have an individual discussion with their physician about the risk versus benefit of receiving the vaccine.
Dr. Gastaldo, thank you so much.
Yeah, we knocked those out. Was that good enough for everything?
That was good. And I do have, while I have you, I have one separate question. We're monitoring the Johnson & Johnson stuff today. You know, the governor did say yesterday that if we get the green light, that's going to be an additional 90,000 doses next week. So that would make 400,000 doses next week to our state. What does that mean?
Well, it means a lot. It means that we're going to have 90,000 more Ohioans get a dose and have immunity. And it's one more step in getting an end to this pandemic. We need to have community immunity, not just within Columbus and Franklin County, but within Central Ohio, within the whole state, in our country, and the whole world. For this pandemic to be declared over, we need to get COVID rates bottoming out, and that's going to happen by everybody rolling up their sleeve and getting a vaccine.
And sorry, one more follow-up question. Dr. Bruce Vanderhoff did speak about the Johnson & Johnson vaccine and its efficacy, and he said that, it's 100% effective at preventing death and hospitalization. So, we hear a lot about the efficacy. So if people are given the Johnson & Johnson vaccine, do they have to be worried that it's not as effective as the others?
Really, when you compare the studies from Johnson & Johnson, Pfizer, and Moderna, it's like comparing apples and oranges. They're different. The Pfizer and Moderna studies were done at a time when we didn't have the same activity with our current variants. In addition, what's really different about Johnson & Johnson is their study had a big input, not only from North America and our country, but also from South America and South Africa, where the variants are a higher proposition in the makeup of the people who had COVID-19. So in the setting of preventing death and keeping people out of the hospital, that's what matters the most when getting a vaccine. That's what matters most when getting a flu shot. When we give people the flu shot, we give them the flu shot to keep them from dying from flu, from keeping them out of the hospital if they get flu. And when it's all said and done, if we can get COVID-19 to nothing but a upper respiratory tract infection, think about that. We are going to prevent people from dying from this and keeping people out of the hospital. Having an upper respiratory tract infection is something that's manageable for people to have versus going in the hospital.
Awesome. Dr. Gastaldo.